International Society of Radiology, Professor Bibb Allan from USA. Actually, he booked his reservations, the flight and everything, but at the last minute, due to the circumstances in the region, he expresses his deep apologies for being not enabled to join us today. But he's very committed to us, and he will be with us online now to present the important views from the International Society of Radiology, which is very important to know what's going on at the global level from his perspectives. Please, the IT, can we start with the presentation of Professor Bibb Allan?
And it's my privilege to be the current president of the International Society of Radiology. The Society appreciates the invitation to be part of your meeting this year, and it's our pleasure to talk to you a little bit about the international efforts of the radiology community to improve care in low and middle income countries. I have no conflicts of interest related to this presentation. The International Society of Radiology is a federation of the world's national radiological societies. And our mission focuses on facilitating the global endeavors of our member organizations that improve patient care and population health through medical imaging. We aim to improve imaging care worldwide by promoting global radiological quality and safety, and in bringing high quality radiological education to underserved areas. The International Society of Radiology is a non-state actor in official relations with the World Health Organization. We collaborate robustly with the global imaging community, and all of these organizations are also non-state actors with official relations with the WHO. And it's through these collaborative efforts that we are able to advance our missions of improving health. We have also been recently collaborating with the Lancet Oncology Commissions. Some of our ISR officers have been involved in these commissions on diagnostics and in imaging care that have the mission of improving global health, particularly by improving imaging and diagnostic care in low and middle income countries. And as a result of these collaborations, earlier this year, the World Health Organization's World Health Assembly approved a resolution to strengthen diagnostics capacity. The ISR was pleased to support that resolution. We believe this resolution will have its greatest impact on communicable diseases. It was the result of collaborative efforts within the medical community to strengthen the capacity for both laboratory and tissue diagnosis, as well as for imaging diagnosis using point-of-care tools such as conventional radiographs and ultrasound. Considering the continued high prevalence of communicable diseases in low and middle income countries, this resolution correctly focuses on strategies to strengthen capacity for early diagnosis and subsequent care for infectious diseases. However, the use of advanced imaging, CT, MRI, and PET, will be necessary to impact non-communicable diseases such as cancer and cardiovascular disease. Non-communicable diseases are having a growing impact in low and middle income countries, and they are contributing to significant mortality that's out of proportion to the higher income nations. Even though the prevalence of these diseases is less than we see in higher income countries, the mortality is high. And we believe that's in part due to limited access to advanced diagnostic images, which leads to delays in diagnosis of non-communicable diseases, which again is an increasing cause of mortality. The IAEA has done a number of studies, including one like this, showing the low penetrance of advanced imaging modalities within low and middle income countries, and an expanded diagnostic strategy that includes screening and initial diagnosis for cancer, as well as cardiovascular disease, will be needed for optimal care of patients with non-communicable diseases in low and middle income countries. This study from the Lancet Commission on Oncology shows that scaling up diagnostic imaging could avert as many as 2.5 million deaths from non-communicable diseases, in particular from cancer, with a net savings of over $1 trillion. And then the impact is multiplied with similar scale up in treatment and care. The International Society of Radiology's strategy for improving access to medical imaging in low and middle income countries is outlined in these two papers from Lancet eClinical Medicine. Our key recommendations begin with ensuring that imaging benefits are included in all strategies for universal health coverage, that they optimize cancer screening programs for breast cancer and lung cancer, and that there is a coordinated effort within the regional communities, and that these collaborations develop strategies to overcome existing barriers to deploying advanced imaging, including research and development that will help mitigate the cost of equipment and the challenges of localizing that equipment at the point of care. Local utility and infrastructure must be upscaled to make sure that the equipment can be installed and properly maintained. The workforce will have to be developed to include training and education about the use of the equipment, the diagnostic capabilities, and importantly, radiation safety for patients and workers. And then we need to be able to exploit and enhance informatics networks and artificial intelligence. And it's these regional international collaborations that will help us get all of this done. And it'll have to include the local governments, the WHO, the IAEA, the APRA, and non-state, non-governmental organizations such as our medical imaging societies. The ISR has existing resources that will be essential to helping lower some of these barriers. Our ISR Quality and Safety Program is an umbrella for regional radiation protection and can provide training and safety optimization as equipment is deployed at the point of care. Our educational activities can convene world-class content from major radiology journals and societies. We attend and promote regional meetings in underserved areas and provide not only clinical but also radiological leadership training. Our efforts are primarily targeted to underserved areas and are provided at essentially no cost thanks to our ISR member societies and other collaborations. And these activities will be key to implementing the current resolution on diagnostics as well as future resolutions from the WHA on advanced imaging. One collaboration that I want to highlight is the one with the African Regional Cooperative Agreement for Research, Development, and Training related to nuclear science and technology. That is a collaboration between the regional countries and the IAEA. And I want to congratulate Dina Husseini Salama, who has been involved in expanding AFRA's role from just nuclear medicine now to diagnostic imaging. And the ISR looks forward to participating in a strategic initiative for diagnostic imaging that will occur in 2024 and hopefully in parallel with the efforts coming out of the WHA resolutions. Another recent ISR collaboration is within the Africa AI Summer School, sponsored by MOHP. And the summer school aims to train data scientists in the region to provide them with the tools they need to make AI safe and effective in lower and middle income countries. So in summary, realizing the goal of increasing advanced imaging capacity for low and middle income countries requires a multifaceted strategy that includes, number one, a united political front, and we'll be following up on these WHA resolutions to ensure that the strategies developed are able to be implemented. This will include addressing infrastructure needs, making the equipment that's necessary affordable and available at the point of care, and expanding the workforce with emphasis on patient safety. And then finally, implementing novel solutions such as AI to assist the current healthcare workforce. And with that, I thank you very much for your attention. And again, it's a pleasure to be here with you.
Really, we would like to thank you very much, Bibb, for being with us at such time difference. We are really honored, and we are expecting you